Maybe you've decided with your physician to integrate low-dose naltrexone into your treatment plan, into your care plan, into your longevity or anti-inflammatory or pain control regimen. I'm Nari Kaur Clemons. I am a certified pelvic therapist, and I love teaching you guys things about how to make your pelvis work well. Okay, so let's talk a little bit about this. I'm not a doctor. I just said I'm a physical therapist, and I'm definitely not your doctor. So this needs to be part of the care plan that you establish with the physician. But I just want to go over some things that I've noticed some of my patients have said over time. I also am on LDN. I have been for years, and there are just some things that I have found have helped me or helped my patients over time. Or maybe you are my patient and I told you, hey, make sure you watch that video. Okay, so let's talk about things. First off, LDN is amazing. How it works is I'm going to talk in very colloquial terms here, okay? It kind of blocks the spots in your brain. They're called receptor sites that the endorphins would fit into. So it kind of blocks those. So the endorphins can't get into your brain. And so your brain is in a low endorphin state for a short while. Then your body produces more endorphins because the body's amazing at adapting. And so it's like, wait a minute, we need more of this. We're not getting enough in our brain. And then the medicine wears off, you have more endorphins in your brain. And then when it wears off, you have more. Now, we don't really understand the full mechanism. Like, why does more endorphins seem to stop the body from attacking itself with autoimmunity? So autoimmune disease, lupus, lichens, not plain painful bladder syndrome, but when it has the interstitial cystitis component where there are ulcers inside it. Fibromyalgia can be considered autoimmune. Sjogren's syndrome, scleroderma, a lot of these conditions that can affect our pelvic health, ulcerative colitis, and some components of irritable bowel syndrome. So we don't understand like why these things with an inflammatory autoimmune presentation are helped so much by low-dose naltrexone. But we have so many studies now supporting they are, and I have a different video called What is LDN that talks a little bit more about that. So here's what happens. When you first take it, I've noticed for myself and many of my patients, people are really sleepy about a half hour to an hour later. You're supposed to take it on a relatively empty stomach. So a lot of people are taking it before bed. Now, often the starting dose is around 1.5, and then most people are working up to about 4.5. You need to get that professionally compounded because the tablets that are conventionally at the pharmacy are 50 milligrams, and so there's no good way to get 1.5 out of 50 and to have it be a consistent dosing unless you have that compounded professionally. So sometimes people notice this at the lower doses, sometimes they don't, which is that they might get very sleepy right after they take it. But then what happens is 4 or 5 hours later, they are wide awake. And definitely by 6 hours, they're wide awake. Well, this is a little bit tricky because with chronic pain, we know that sleep is incredibly vital. Some people can take it in the morning and they never get the sleepies. So some people can take it in the morning with their coffee and they never get their sleepies. Some patients are really sensitive and they do. So for those patients, again, I'm not your doctor. I'm just a physical therapist who takes this med herself, who has patients who take this med. What some of us end up doing is we drink a strange amount of water before bed and we go to bed. And then when we have to wake up during the night, 3-4 hours later to use the restroom, maybe 5 hours later to use the restroom, we lay one out on the counter every night so we don't accidentally take 2. We lay it out before bed and we just take it then with a little water and go back to bed when we get up to use the restroom. And then we sleep really hard the rest of the night and wake up quite alert and quite ready to face the day. So that's one strategy that some people find helpful if you're finding that taking it in the morning makes you zonked, but then taking it at night, you're having trouble sleeping through the night. So that can be one of the things. One of the other things can be building up. So there does seem to be some people who can go from 0 to 4.5 in a month, and it's just gravy. They're fine. There's no problem for them. And then there's other people who have a harder time. It has seemed consistent that people who have an overgrowth of yeast, now these are just patients who are telling me they've had SIBO, that they have an overgrowth of yeast, or they have some mold or other things that their bodies are trying to detox, that reaction can be stronger. So I'm going to self-refer here, which I don't normally do, but because I want to be really clear, I'm just talking about me. I'm not talking about the research. I know I tried to take this years ago when I was in Indiana, and there was so much pesticide in the water. So the EPA has a rating for water quality, and it's from 1 to 100, 1 being the worst, 100 being the best. And for me in Indiana, I would try to get on it, but the rating for the water there was 1. And even if you're like taking a water bottle, you're still cooking with the water, you're still bathing with the water, and I would get terrible cystic acne if I ever tried to take it. I moved to Oregon, the water here, I did fine, but I didn't know about the whole gut detox and some of the other things. So sometimes patients will start to take it, they're not tolerating it that well, they might have to do a little bit of a heavy metal detox, or you need to work with your naturopath on like what they find that you're toxic with, or what they might find your dysbiosis is. Like, I'm not your doctor, I don't know, and I'm not saying to just throw darts, but sometimes there's a piece of detox that needs to happen for people. Some of the signs that you might be moving up too fast is, again, you might break out in rashes or acne or some kind of detox type reaction, or headaches. So for me, I know that when I go up in a dose, it took me 3 years to build up to 4.5. Again, I know some people who can do that in 3 weeks. So you have to honor your own body. I have found that some people who have a history of endo and stuff, when they go up too fast, they'll be okay for a few weeks and then they feel horrible. So my personal recommendation when my patients are asking me is, first, ask your own doctor. But secondly, if you have a chronic health condition, build up very slowly. These things are never a sprint. It's a marathon. You want to live the rest of your life with increasing wellness and increasing happiness. And so this idea that there's this place to get, I think is really worth divorcing. Similarly, if we clean up our diet, it's better to clean things up like one at a time. Like if you're having Diet Coke, get off that aspartame. You know, if you're having a lot of gluten, start to cut that out. Or if there's a lot of sugar, you could start to cut that out. But we don't always want to cut out everything at once. Just like if we weren't used to working out, we don't want to suddenly go to the gym and work out 2 hours a day if we have chronic illness. We want to start with like, how can I start to build a little muscle without straining my adrenals? If that goes okay, then how do I add a little more? A little more, making sure I'm getting the nutrition to help my body recover. Same thing with LDN, a little bit at a time if you've had chronic conditions. So if you're getting headache, if you're getting excessive fatigue, if you're having a hard time with focus, these can be signs that you're moving up too quickly. Now, one thing that's interesting is LDN has also been used in some cases for binge eating. So there was like a designer drug that came out that was a mix of what Wellbutrin is, bupropion, and a small dose of LDN. But the problem is it was like $200 a month and nobody could afford it. But some people who find they have a really hard time regulating their food, some patients will work with their physician to get 2 separate prescriptions, one for Wellbutrin and one for LDN, and that can help. I personally noticed that I have way less sugar cravings on LDN. I don't know, it just seems to happen that way. So these are just a few tips and tricks that people talk about. And one of the things that all of my patients seem to talk about who get on LDN and stay on is this. If you've had a chronic condition, you will know what I'm talking about, or if you have autoimmunity. You can be moving along with your health, and then you have a flare and you dip down. And it takes so much of your body reserves to get back up to where you were. So then you're stuck at the same point. You have a flare, whoop, you go down. Takes all this work of your body to get back to where you were and keep going. A lot of us with autoimmunity find that with LDN, we're not really flaring. So instead of my body having to accommodate to every flare, what seems to happen is like a little momentum gets to build. So my body can use that energy to do a little better, and then like maybe the flare looks like this instead of like this. And so then it can keep using that to slowly get better. A lot of patients don't say they feel that different in a week or a month, but a lot of the patients I've seen who take it, they feel very different at 6 months because they haven't had to recover from those flares. I'm used to palpating organs. I do a lot of organ manipulation, a lot of visceral work, and I do a lot of internal pelvic work. So I'm used to like palpating mucous membranes because the vagina lining is a mucous membrane, and working a lot with organs. And I can feel a difference in the motility and mobility of the abdominal organs when my patients with endometriosis or PCOS are on the LDN versus not. I literally will be working with them and they'll feel stickier. And I feel like this or serapeptase, which I have other videos on serapeptase you can watch for endometriosis. I feel like those are the two that my patients who have had excision and are recovering from endo, I'm like, these are your two friends for life, unless you have a contraindication. And when people forget to get it filled and they get off of it, I can literally feel, I'll be working with their abdominal tissues. They'll be more sensitive, more sticky, more painful. So, nobody wants to be on something forever. But if one of my patients is going to undergo endo excision and go through all of that, I'm like, let's keep the surgeries at 1 if we can and not have to have repeat. And so part of that whole program of care after surgery does include serapeptase and low-dose naltrexone. Thank you so much for listening, and I hope to see you in another video.